Possibly 18 crore children are at risk of getting infected by coronavirus. Do we have the infrastructure to safeguard our children? What is the government doing to overcome this uphill situation? Let's find answers to these questions and much more about the effect of coronavirus on our children in this edition of the Viral Mail. India grapples with escalating virus cases in the second wave of the coronavirus pandemic. Several children are testing positive for COVID-19 infection in many parts of the country. In the first wave had 4% of children being affected by coronavirus, whereas this figure has gone up to 10% in the second wave. Doctors across have confirmed that even newborns and infants are testing COVID-19 positive, though their condition remains under control and rarely turns fatal. However, children between 5 to 12 years are at a greater risk. In some hospitals, mothers have to accompany their children who are showing severe symptoms. In a meeting with district magistrates and field officials of 10 states on Thursday, Prime Minister Narendra Modi called for the collection of data on the transmission of COVID-19 among youth and children in each district. He said such data must be analyzed regularly to protect them. Why COVID surge in pediatric cases? New mutant strain of virus. Lack of precaution in households. Increased exposure in vulnerable areas. No vaccine for children. Pediatricians caution against self-medication for children, administration of antibiotics without detailed examination, and suggest immediate medical help for the child. Parents need to carefully observe a child's symptoms. Gastrointestinal symptoms like diarrhea and vomiting. Others are rash, conjunctivitis, vasculitis, apart from fever and cough. The B.1.617 variant is said to be behind the severe second wave of COVID in India, which has affected more children than in the first wave. This time, India reported children as young as newborns being infected with the virus, something that was rarely heard of during the first wave in 2020. There are an estimated 30 crore children in India. About 18 crore children are vulnerable because there are no vaccines for children yet in India. If only 10% get infected, then this will mean 1.8 crores will get affected by a coronavirus. If only 1% need hospitalization, then 18 lakh beds will be required. Our health system is not ready for this. As per the estimates, there are only 70,000 pediatric intensive care units in the country. These units are available only in bigger cities. Smaller towns have no pediatric facilities. The number of children with COVID-19 needing hospitalization and intensive care has significantly gone up. This undoubtedly paves the way for an immediate vaccination program for children and adolescents in India. With warnings from experts, and a second wave that has served as a lesson on how prepared the country is, states are already taking steps to ensure there are arrangements in place to protect children. The Delhi government has already planned a special task force to protect children in the national capital. Arvind Kejriwal has taken some important decisions in a meeting with the officials. To create a special task force to protect children from the third wave, adequate beds, oxygen, and better management of essential medicines. The Karnataka State's Women and Child Welfare Minister Shashikala Jole have announced several measures for COVID-19 management among children. While pediatric COVID care centers will be set up in all districts, rehabilitation centers will be set up for orphans. BMC has planned to set up a pediatric COVID care facility in Mumbai and a creche network for children whose parents are in hospital for COVID treatment. Officials told that the pediatric facility for children before 12 years of age will come up within the next 2 months. While most countries across the world are still in the process of vaccinating their adults, several other countries have begun vaccinating children. United States Centers for Disease Control and Prevention has cleared Pfizer Incorporated's BioNTech shots for use in the ages 12 to 15. The United States has administered COVID-19 vaccinations to around 6 lakh children ages 12 to 15. Singapore is also vaccinating children aged 12 to 15 with the Pfizer-BioNTech injection. At the moment there are only 2 vaccines available in Indian markets, and neither of them has data on trials on children. While Bharat Biotech got the approval of the Drug Controller General of India to start Phase 3 trials of its vaccine for the 2 to 18 age group, it is going to begin in the next 10 to 12 days. However, Pfizer has said earlier this month that it was in discussions with the Indian government seeking an expedited approval pathway for its COVID-19 vaccine. Meanwhile, 20 children in Karnataka's Pelgavi received the first dose of Zydus Cadila-Zycov-D COVID-19 vaccine as part of its Phase 3 trials. It is unclear when vaccines will be available in India for children before 18 years of age.